So today's World Cancer Day, and what we've done is had a conference to review various aspects of cancer care here at the Norfolk and Norwich. We split the day, broadly speaking, into two areas, one for staff, and that was discussing our 5-year strategy along with partners from the SDP and other areas to sort of showcase really what we're doing, where we want to be and how we're going to get there.
I want to just highlight the work that actually all of the 3 hospital trusts and primary care and the local county council have been doing together around cancer, and to improve services and outcomes for our patients and to flag over the next year. We're going to have 3 main areas that we're going to be looking at. One is working with colleagues in primary care, nurses and doctors, for actually how we can help improve the number of our patients that will come and have screening done for cervical, bowel and breast screening. And the reason we're doing that is that we know if we can pick up patients that don't have any symptoms of cancers, and actually if they're picked up, they're detected when they come for these screening tests, there's a much better chance we'll be able to offer curative treatment for those patients. So we're going to have a big focus on that. The second thing is we're looking at introducing more services in the community for cancer patients. So for ones that are needing to have chemotherapy or for follow-up after they've had chemotherapy or radiotherapy, we're looking to have specialist nurses that will be able to see patients either at home or at local hospitals like Cromer outside of our main site here in Norwich, which that will be great for patients. It'll involve less travel for them, less worry, and also it will be helpful for doctors and nurses who are working here in the hospital as well. The final thing that we're going to be looking at doing is, because there's most patients who get referred in by their doctor to see if they have got a cancer, they actually haven't, but it's a really worrying thing and they need to have tests done very quickly so that the small number that do have a cancer can be treated as soon as possible. So we're going to be looking at setting up things called rapid diagnostic clinics in all 3 of the local hospitals, initially for patients that actually have got just what's called vague symptoms of cancer, where it's not clear what's going on, and also for patients with suspected lung cancer, and that's a big bit of work for this year.
In the afternoon, what we did was invite patients, relatives and other members of the public to come for slightly more patient-centred discussions about the RESPECT programme, screening and various other important aspects of cancer care. We've also had a marketplace with different partners from different cancer groups, head and neck, fitness and wellbeing and various other partners. The Norfolk and Norwich's place at the moment is we are pretty central really into what happens in Norfolk, both in terms of delivering clinical services and research, because we're partnered with the Norwich Research Park at the Quadrum and the UEA in terms of delivering on quite a lot of areas of research. We've also had a pledge board, and the pledge board was all about linking into I am and I will, to encourage members of staff, members of the public as well, to pledge and to join in really in what is a global event in World Cancer Day.